Alex, I just wanted to have a bit of a chat to you about this morning's orthopaedic clinic that we're involved in, and just wanted to share some of the experiences of that with you. How did you think it went?
I felt it went really well. It was busy.
Absolutely, it was a very
really
busy clinic.
But I think it went alright. Did everything.
Okay, so we had a lot of diverse patient examinations that we had to complete, and as you know, there was a lot of people waiting along the time. How did you feel you coped with the knowledge that there was a lot to be done?
Oh, I thought I went alright. It was a bit difficult swapping between hands and legs all the time, but I thought it was alright.
Okay, so from the perspective of the imaging, I think you did very well. There was a lot of high quality images that you were able to produce in the time. How did you think it went in terms of the patient experience? So if we take, for example, Mr. Smith, who was for the weight-bearing knee, how did you feel that you coped with his particular issues?
Well, it was very difficult to position him for the image that we needed to position him for, because he was quite sizable. But I thought I went alright.
Okay. Look, I think you probably, overall, the outcome was fine. I'm just not sure that your approach to Mr. Smith was perhaps the best we could do. There's things we could do to improve.
Okay.
I think that one of the things that happens when you're in a hurry is that often that can be transmitted to the patient as well, and it's important that patients certainly need a little bit more time to move around the room. We wait for them and give them that respect and patience. So I think it's really important to recognise that while we're focusing on the technical aspects, there are lots of other parts of the examination that are important for the patient's experience.
Yeah.
And perhaps from next clinic, which I think there's another one tomorrow afternoon, which is likely to be just as busy. Perhaps one of the things you need to focus on is not so much the technical side, because you're clearly quite competent in that area, but to spend a little bit more time in terms of the patient and providing the experience so they don't feel as though they're being rushed and hurried, and that you're not feeling under pressure because of there's other people outside. So can you think of things that you might be able to do to help you do that?
I guess if I'm not so preoccupied with trying to get... I know I can get the images right, but maybe I'm focusing too much on the images. But like you said, give people more.
So what sort of
time.
things, what sort of strategies might you use to help that along?
Probably slow down my approach to the patient, because I tend to rush them.
Yeah. And perhaps, you know, speaking a little bit more slowly. When we're in a hurry, we tend to speak more quickly, but perhaps, and certainly, you know, with many patients who are a little bit older, that can be confusing. If they've got a hearing aid, it's hard to hear people who talk quickly. So perhaps something you could try is just to deliberately slow your discussion with the patient so they can feel as though you're taking time to explain the procedure to them rather than it being a rushed dialogue. And I think that if we can focus on that for the next session, hopefully you'll feel as though you've achieved the outcome with the patients feeling a lot more engaged in the activity and a little less rushed.
Okay.
You okay with that?
I'll keep that in mind.
All right, well, let's try that tomorrow. I'll be working with you again tomorrow,
Okay.
and we can have another little opportunity to have a chat about it afterwards.
Okay.
Okay?
That's good.